So, Lucy, shall we start? Okay. Uh, Good evening, good afternoon, good morning to everyone from whatever part of the world you guys are. And thank you again for joining me. And today, since this is my final presentation of the series, which was started by Woodpecker. I would like to thank Woodpecker first that they have given me an opportunity to share my expertise or my knowledge about the laser through different topics, and all topics whatever we have covered were very close and very dear to me. And all these topics, like I can say, I have learned most of the whatever I'm speaking today, I have learned over the practice of last 12 year what I'm using lasers. So today we will be talking about practice management with dental lasers. Those who are joining me for the first time, for them, I am a graduate from College of Dental Surgery, Manipal, which is in Karnataka, beautiful city. I did my post-graduation from JSS Dental College, Mysore, under guidance of Professor Dr. M.K. Manjunath. I'm taking his name because I feel he was the one who to molded me to become a better dentist or better teacher or better something whatever I was. So my gratitude to him. uh, for my laser credentials, I have done my diploma in laser dentistry from Sultan University of Sharjah. Long back, it was in year 2010 or 11, I believe, 10, I think. And then I went on to do my master's in laser dentistry from SOLA, University of Vienna, Austria. I'm the only Indian right now who also holds advanced proficiency in laser dentistry from Academy of Laser Dentistry USA. Beside this, I have a standard proficiency in laser dentistry from ALD USA. So these are my laser credentials. I've worked as a professor for almost 19 years. Right now, I'm managing 3 practices in Lucknow, private practices. One of my clinic is these are the interior of my clinic. My clinic number 1, my clinic number 2, and this is my first clinic from where it all started. It is in Patkarpuram, Gomti Nagar, Lucknow. I'm situated based in Lucknow. This is my clinic I just opened after COVID time. So this is my latest clinic, third clinic, and you can see most of my clinic, like all my clinic, have equipped with the whatever I'm talking. I have all the access to all the equipment, microscope, hard tissue laser, soft tissue laser, and other facilities and all. I'm using Woodpecker since almost 3 years, and I've done couple of 100 cases with that. So quite a decent journey with Woodpecker I'm sharing. Let's go to the topic. This is why about my clinic. If you remember, in my all lectures till now, whatever webinar we have covered, I have shown you dental videos. Today, I'm not showing you a dental video. Rather, I'm starting a video for something which is related with the science, something which is related with the precision. So we'll start with that video. It's a commercial I've downloaded from commercial of a Volvo truck, and I've downloaded it from uh, YouTube. So let's go through that. Why I like this commercial a lot. We will talk about that later on. Let's go through that commercial, and then we'll go to my topic. Right. So we shall discuss today following topics: patients' expectations, dentists' expectations, laser dentistry integrations, and how when all these three joints or joints together, we can increase productivity. And whenever we talk about increased productivity, means we are increasing more patients and we are increasing more revenue. So in the end, we will be discussing about return on investment and return lesser number of patients recall and other things. So let us start with the commercial laser dentistry. Why? So start with this video what I was talking.
I've had my ups and downs, my fair share of bumpy roads and heavy winds. That's what made me what I am today. Now I stand here before you. What you see is a body crafted to perfection. A pair of legs engineered to defy the laws of physics. In in a mindset to master the most epic of splits. Can't say where the road goes, where the day flows, only time. And who can say if your love grows, as your heart shows, only time.
So this was a precision or defining law of physics was done for the Volvo, and today we are talking about the precision with the laser dentistry. Now, first question comes first: why should we buy laser? There are many questions. I'm already doing well. Uh, I don't know how to use laser is not going to like few years back when I started lecturing, a lot of people used to say laser is just a marketing tool. So many questions are there, and I've tried in my today's my lecture that let me try to answer few of those questions. So to integrate laser, there are the two aspects. As a dentist, we are driven to change, and the two main reasons why we change, first is the personal drive. We want to change because we want to do better, or we want to maybe we are bored with the normal routine, or we want to upgrade like that, or learning, like there is a philosophy of the life: learning, unlearning, and relearning. So many aspects are there. And then other reason why we change because of our patients. Now patient, this is a very important aspect of the laser dentistry, because laser has benefit not only for doctors or dentists, but even for the patients. Let's go through patient psychology first. Very important aspect, and we need to understand patient mentality, patient psychology when they are coming. So these slides, whatever I'm going to show, following few slides, I've taken data from, I mean, these are the survey which has been done by Wikipedia. There are some survey which has been done by us when we were working in a college, and some have gathered again collection from the different articles. And also we change for our patients. We have taken an oath to provide the best care we positively possibly we can, and change allow us to do that better, right? So certain words I'm using here: dental phobia, odontophobia, dentophobia, dentist phobia, or dental anxiety. These all are same thing. And this data, whatever this word I'm talking, I've taken it from again Wikipedia. It is estimated that as many as 75% of US adult experience some degree of dental fear. You can see in the slide also, the down the cartoon. I mean, dentists are like the joke of many cartoonists for the like many cartoonists are making sketches for the dental and all those things. So uh, think about it. The data says 75% of US adults experience some degree of dental fear from mild to severe. USA has a pattern. America, they have a pattern. They have a habit of visiting dentists for regular dental visits, and they have a school of health program and lot of things and all. Imagine about this part of the world, India, where still more than 70%, 80% population has never visited to a dentist. This is surprising. Lot of us, we talk about dentistry, there is stagnancy, so many dentist clinic are coming, and so many dentists are there, and what you call, I mean, competition is high and all. But think about it, still in India, more than 75% people have never visited to a dentist. That means almost 100 crore people are there who have never gone to a dentist. So it's a decent, huge market is still for us. Now, why I'm talking about this uh, right now here? Because we are talking about practice management. So practice management, when we talk, we also need to see the what are the market for us. Why people have never visited to a dentist in India, or even in the other places and all. So think about this. The reasons. So we did a survey, and we tried to, I mean, this survey was like the three part of the survey was there. One we did in the school where we were dental school where we were working. One we did at the different market areas and all, and one at the clinic private practice where we are working. So the reasons, the topmost reason why people hate visiting dentist is, this is again in a cartoon. People have psychology. This is like I'm talking about. Patient have a psychology that whenever they are visiting to a dentist, it will be experience which they can experience, like which will be same something like similar like a hell. So the reason again why, the first reason the people hate dentists is the pain. It is going to hurt. That is the question on everybody's mind whenever they sit in a dental chair, and it is easily the most common reason that people hate dentists. More, I know many patients, like whenever we talk to the patient, they come, they visit us. I mean, I'm not able to give you exactly percentage wise data, but many patients they come to us with the grossly decayed teeth, and they have this. And when I ask, like, you must have started with small cavity and all, why you have come so late? So because I know dentist, you will give me injection, you will do that and that, it is going to, your treatment is going to hurt. So remember, even if anybody is watching my webinar who is not a dentist, dentist job is not to give pain, but dentist job is to remove your pain or relieve from your pain. So modern dentistry should be comfortable and easy. Now dentist friend, only my dentist friend, when we talk about this, like people don't come to the dentist because they are scared of pain. They will say, sir, no problem, doctor, no problem, we'll give anesthesia, right? We will give an anesthesia, we'll give a LA injection, and then the patient will have no pain. So the reason why people hate dentists, second reason why people hate dentists, it is again very important. The greatest lie ever told, trust me, it will never hurt. Injection, it hurts. Second psychological factor, again, the people hate dentists, is the needle. I gave the note to the biggest phobia. Fear of needles and injection is used for some people. It is again among the top 10 adult phobias. You can go through to Google. This is not like I'm writing on my own. I have taken these data and these figures from various articles, journals, and all. So it is again among the top 10 adult phobias. And children are even more fearful. I didn't dare show a picture of needle here because even the image will upset a phobic person. So the second reason why people hate dentists is the needle or the injection. They have a psychology, they have a mentality, or they have understanding through various research, Google and all, that whenever they will visit to dentist, even for the minor procedure, they will be getting some kind of injection, right? So this is the second reason. We have got more reason why people hate dentists. And why I'm talking about this again, if you remember my previous webinars and all, if I have a laser, I can do majority of the treatment painless, and in more than 80% treatment, I don't have to give even anesthesia. So these are the advantages of laser dentistry from patient perspective or from the patient point of view, which I can always communicate. Remember, communication is very important. Whenever you're talking to a patient, communicate them what you're going to do a proper consultancy and explain the procedure what you're going to do, whether you're doing a laser dentistry, whether you're doing a smile designing, whether you're doing a endo treatment and all. Communication is very important, and you need to tell advantages of the procedure, give them options, like this is the option 1, this is the option 2, like that you can give them an options. And with the advantages of laser, you can always communicate, right? Third reason why people hate dentists, the sight of the blood and bleeding. It can disturb to many people. I'm not sure how many of you have felt this, but when I was in undergraduate, I was in BDS third year when clinic started. Even my colleague got fainted in oral surgery classes. I still remember in oral surgery clinics when they saw blood was coming out. So blood can disturb to many people. And parents, when we talk about kids, parents are very apprehensive for treatment of kids. Now, when I say again, from the laser point of view, if a kid is coming to me for minor surgical procedure and all, and I explain the procedure to the kid, to their parents, and when I say I can treat without giving any anesthesia or any injection, it will be painless and there will be no bleeding at all, we get a wonderful response. So this is again, I'm talking about patient perspective. The three reasons why people hate dentists, I told: number 1, pain; number 2, needle; number 3, blood. We have got more reason why people hate dentists. So let's talk about the fourth reason why people hate dentists. Invasiveness. Dentistry is invasive. We are right inside your mouth performing our gum gardening and tooth carpentry, and this can definitely feel like an invasion to your personal space. If the dentist is not graceful, gentle, and respectful about your care, you could feel almost violated by the invasiveness of most dental procedure. Again, the invasiveness when we talk, most of the procedures. See earlier concept again. I don't have to explain much, but if just two words are more than sufficient for me here, like the GV Black proposed extension for prevention, and current concept is minimal invasive dentistry. So we are going for minimal invasive dentistry, and laser helps in that. Whether I'm using a hard tissue laser or I'm using a soft tissue laser. So whenever I'm using a laser, my procedure becomes less invasive, right? Fifth reason why people hate dentists is the sounds and smell. With any measure of anxiety or fear, your senses are put on high alert. You become hyper aware of sight, sounds, and smell. Some people hate the antiseptic smell of medical and dental offices. We do our best to keep our office sensually attractive with a spa-like atmosphere. You will feel our warm ambience with light jazz in the background and our soothing waterfall and medical grade air purifier to maintain a fresh, clean smell. Now, drill sound can irritate a lot of people. So whenever I'm using a drill sound, even the vibration, but whenever I'm using a hard tissue laser, I don't, I can do a preparation without touching the tooth, so there won't be any vibration. Same way in the soft tissue, if I'm using a soft tissue laser for surgery, here, unlike cautery, there will be no smell or burning. If you're using proper parameters or correct parameter and setting, there will be no smell, foul smell, smoke, or plume generation. So laser also reduces sounds and smell. The last reason why people hate dentists is anxiety. Now this has to be the worst part, and you can see on the right side, like where we have put a cartoon also. Uh, in many dental clinic, people keep aquarium to relieve anxiety. I mean, there are the many way uh, we work on to relieve anxiety or reduce anxiety. You can play music, you can play you can play light music, you can keep waterfall, you can keep water bodies, or you can keep even the aquarium and all. But have you ever thought why people are anxious? Now, this has to be worst part, and why people are anxious, because you have to again go through the all five aspect, because they are anxious. The anxiety is more because they think that treatment is going to hurt. They think treatment dentist is going to inject me, and they think that there will be bleeding and all. So if I can cover all those and I can explain my treatment to patient that, see, your treatment, I'm not going to do any there will be no pain, hardly any bleeding, or no bleeding at all, and I will not give you any injection. You can always control and reduce the anxiety also. So this is the threat of pain, other triggers of fear that build up the anxiety and make the miserable experience. So laser helps me to reduce all these factors what I've just discussed and control. So patient perspective again, for patient point of view, the treatment will be less invasive, more precise, less painful, better healing, lesser number of patient recall, wow effect, and less bleeding. So this is from the patient management point of view and patient psychology, or you can say the explaining and selling your treatment plan to the patient when you're introducing a laser or when you're working with the lasers dentistry, right? Let's talk about dentist point of view. Now, when we talk about dentist point of view in the laser dentistry, uh, treatment which we read but we never used to do. Now, theory, when we talk about theoretical part, we have read almost all the treatment, whatever we have read about gingiviectomy, we have read about syrinectomy, we have read about root canal treatment, we have read about, let's say, ortho treatment. I mean, all the treatment we have read because it has been taught in our syllabus, except laser. Unfortunately, laser is still is not there in the curriculum. And initially, I remember few years back when we started our lecture, we used to call all the lectures, whatever where we are discussing laser, we used to name that lecture, I remember, dentistry beyond syllabus, because it is not in the syllabus. So we have been taught many treatment options, many treatment plan, except laser dentistry. But how many of us, like how many of us, like, treatment, whatever we have been taught, we follow? I'm a guilty of that. Personally, not following the protocol which I should have been follow. Communist example I'll give. Of lately, I've started. I mean, I've made it mandatory. But like a simple example, I can give you. Whenever I'm doing a root canal treatment, placing a rubber dam, it's a protocol which is given, which should be followed. But unfortunately, most of us or many of us are not following. We follow, we give pictures only when we have to show or post on the social media, or show on the what do you call, in the lectures or in the documentation and all, then only we place rubber dam. Otherwise, I know many of us are not following. Few are following, but many of us, majority of us, are not following. So now I'm talking about laser dentistry. So what is the advantage of laser dentistry here? Like treatment which we have read, but we never have followed. Simple example I want to give you, and this is not from my specialty, but from a prostho specialty, is the placing or using a retraction cord. Now, this is again very interesting. If in our part of world, what happens if we have done a crown preparation? If crown is fine, everything is fine, seating properly, it is dentist ability, or dentist is very good. If there is any fault, it is not dentist fault, but it is lab fault. We always blame that lab has not made it rightly. So the things what we have to follow, again the protocol, like we are supposed to place a gingival tissue retraction cord, and it is mandatory, especially margins has to be there, especially if we are doing a smile designing cases, or where we are using minimal prep like veneers, anterior veneers and all, we have to place a proper retraction cord prior to take an impression. But hardly let's say, if we go on to percentage, here I can talk, hardly 5% of us are using it. And this again I can talk like I discussed about rubber dam. I can tell, even the prosthodontist, majority of prosthodontists are not using retraction cord. So what happens in the end? You come up with some sort of some sort of finish line. The impression is not that clear, and finish line is not proper. So why I'm talking about this? If I have access to laser, okay, the reason also why we not place retraction cord, because sometimes placing retraction cord can take 5 to 10 minutes, or even up to 15 minutes, right? So 15 minutes is a time which usually we want to avoid. We find it messy and all. With the laser, I can do something which will give effect, something like retraction cord type of effect, but it takes very less time. So what we call it troughing. So troughing, what we do, how we do: lightly contract the sulcus lining just inside the crest of the gingiva, while resting the side of fiber against the tooth. Make short stroke, do not go circumferentially in one pass, actually incising the tissue, and keep fiber angle towards the soft tissue, not towards the tooth and implant. So I can always take a laser. If I have access to the laser, I can take it all around the sulcus, and I can get effect similarly, something like that retraction cord, and it takes very less time compared to that. 45 seconds to 1 minute, I can do interior 6 teeth. And I can show you some images also of the impression taken after the troughing. So you can see one impression here prior to a bridge, and you can see the finish line and margin. And if any prosthodontist is here on the by today's viewers, they can comment on that. All right. Or also there are more treatment protocols which we could have we can do, which we were not doing earlier. Now the example whatever I'm talking today are the example which I'm doing right now, and they are my example. So I will not say it is for everyone, but yes, for me these are like the example for me. But it is applicable to most of us. So the treatment what we have read but we have not used to do. Another, I will show you the treatment of aphthous ulcers, herpes. In my last webinar I've shown the videos also. So right now I'm not going to show the video, as I feel if that is going to take more time. So unless you want, I can show share personally. let us talk about more today about the management side. So the treatment, now aphthous ulcer treatment, nobody used to do chair side, because as such I have not read any treatment. If you don't have ulcers, just apply topical steroids and painkiller or multivitamin. That is the only treatment like we have been taught. Even in the oral medicines, like certain more medicines you can try, but no chair side relief. With the laser we have an advantage, we can treat chair side, right? So this is like the pre-op, post-op, and other treatment also I can talk, which we have, which I was not doing earlier, but we've, once I have got the laser, I've started doing. This is the post-op of the laser, same case of the aphthous ulcer. So we have done the cases which we have read, but we have not performed earlier. Some more I can show you these type of cases and all, like earlier. And I'm talking, see, the people who are in who have done masters in perio, who have done masters in oral surgery, for them this is frequent. But for uh, person like me, who was not exposed to all those procedures and all, these were the some procedure which were like who were not exposed. So these are some procedure which I read, I remember, but I never performed. So laser gave me an opportunity to perform these procedures. So these are the things, like again, these are the things which I used to bypass. Like if a patient is coming, so the famous saying, eyes can't see what brain doesn't know. So I remember, I mean, earlier when patient used to come focus with, they used to focus on the main problem, and I used to just focus on the chief complaint. Now when a patient comes to me, I see, besides, of course, chief complaint we have to see and we have to cater. Beside catering the chief complaint, I also see if there is any anomalies, soft tissue anomalies, hard tissue anomalies, if there is any fibroma, if there is a high frenum attachment, if there is space. Like many time patients are not bothered about the space. I'll show you some more cases. Okay, this is the post of the same cases. I'll show you more cases and then I'll explain. This is the case of leukoplakia. I have used again with the 980 lasers, pre-op and post-op, and also this is some more cases. So what happened in the end? I performed procedure they were new to. Besides this, there are certain more procedures which are new to me. Like for me, most of the procedures, like I just showed, whether it is treatment of aphthous ulcer, whether it is a treatment of aphthous ulcer, whether it is treatment of leukoplakia or pigmented lesions and all those procedures were new to me, because I've never performed in my clinic. But now I'm performing, and like I told earlier, like whether I was just focused on the chief complaint, now I am also looking for other issues in the teeth, operculectomy, uncovering teeth for orthodontics, right? So next reason, again, why dentist point of view, why should we introduce laser in dentistry? See, laser is widely accepted in other stream of medicine. We all know. I can show you some pictures also. For facial rejuvenation, derma laser is very popular, and of lately, people or patients, they are very specific. They know what they want to get it done. They want to get hair removed with the help of a laser. They want to get laser resurfacing done. They want to do laser peeling and all those things. Same way in opto laser, LASIK surgery is very popular, and people know. So laser is not like something new in the field of medicines. For common people, it is state of the art. I mean, they consider there is an ophthalmologist who is a normal ophthalmologist, and there is a ophthalmologist who has access to a laser. So the ophthalmologist who has access to the laser, he's better, he's modern, he's got more equipment or better equipment, and he got advanced facility. Same thing when you're introducing laser in your practice, you will become better, not only yourself but also in the patient's point of view, because you are someone who is getting who are getting advanced treatment possibilities and options for the patient also. So it has already been accepted in other stream, why not in medicine, why not in dentistry, right? So again, on a topic, frontal as a marketing tool, why not? When a derma people, if a derma people can use laser for a marketing tool, if let's say optho people can use laser as a marketing tool. Why not in dentistry? So, but here when we talk about marketing dentistry, we have to go step by step. So certain protocols we have to follow. Of course, ethics guideline, whatever set by different governing bodies. Beside this, there are certain way where we can market. So how we market, like there is a bulk SMS service. You can always, if you have got a, let's say, lasers, you can always go through bulk SMS service. Like this is the one I have given you one example where we have sent text to the patient. Now, off lately, there are a lot of patient management softwares also available which send SMS on patients on dentist's behalf to the patient. Beside this, you can always add your own note. Like we look forward for your seeing you at 5:30 p.m. appointment for laser whitening. This is I have mentioned. Beside this, you can send small SMS like laser tooth whitening can be done in less than 21 minutes. That is the one SMS, which can be sent. You can always send something like that. You can send root canal treatment can be done in a single visit, like those. So these are the like some marketing tool which you can always use. Beside this, you can send personalized emails. So email website designing, one particular advantage of online marketing is that it can easily reach to a huge number of individuals in a short span of time. Plus the advertisement lasts longer and it is unlimited. So personalized email you can always send. Also, you can design your website plus marketing on social media platform, different platforms. You can go ahead. So like this, I can send like the personal messages. You can always email. Like you can always make annual, monthly or weekly letter type where you can whatever are your expertise, you can define those expertise. Like here I have given you one example like of a dental laser. I can always send emails to the patients like we have got a laser, which are advantages of this. And same way, like weekly you can make a letter. In one letter you can say one week you can talk about bleaching, another week you can talk about periodontal issues, another week you can talk about uh, let's say root canal treatment, restorative dentistry, smile designing, like that. So many topics are there which you can talk, and you can always send to email. So it is also important to collect data of your patients, like whenever your patients are coming, and they like also, if you're sending a personalized email to your patient, they like it, they prefer that way. Some that way that a doctor is taking care and doctor is telling me about their technologies and technologies or techniques and all those things. So it gives a personal connection with the patients, right? So this is how you market. And also as a practitioner, we are constantly looking for ways to improve our dental practice. So we seek at getting the latest technology to speed up production, appointment only the very smartest employee, and trying to keep up with the latest trend. One of the fastest and most sustainable approaches to a more profitable practice is to increase production. And laser also helps in increase production. How laser helps in increase production, we will discuss over next few slides. So let's go to my next slide now. Following the current trend and concept like minimal invasive dentistry. I have already discussed about minimal invasive dentistry, so I'm not going into much detail. Let me show you some slides and all. This is for the perio treatment. Now, when we talk the laser 5 perio treatment, and this is how we do you perio treatment, you measure the depth of pocket, and then like the previous slide you have just this is for the perio treatment, and whatever is the depth of pocket, you calibrate the you measure the length of the fiber 1 millimeter less than the pocket depth. We have already discussed this, so I'm not going into the detail. But what is the relation of perio, laser, and my today's topic, practice management? We will talk about that in my next few slides, and it is important. So we were talking about increased productivity. Increased productivity, how? Lesser number of patient recalls. One example, like I just mentioned, like we have never done a frenectomy before I got introduced to laser. But once I have got introduced to the laser, I've started doing frenectomy quite often. Now I want to show you some more slide. Like my wife is orthodontist, so we used to get lot of cases where there were impacted canines, impacted incisors or other teeth and all. And what we used to do earlier, before prior to lasers, we used to do surgery in one appointment, and We used to recall the patient after 3-4 days, because conventional surgery, whenever I'm doing a conventional surgery, it takes time, 3 to 4 days to heal or 5 days to heal. We can call patient next day, but then again patient, they were see, there were 2-3 aspects I can recall with my personal, I can tell from my personal experience. Like, you give an for conventional surgery, if you're exposing a teeth, you have to give anesthesia injections, and then you have to control bleeding, and you mention all those, like patient not to eat anything hot, not anything spicy, and all other protocol, maybe antibiotic also, painkiller, mouthwash, and all those things. So we used to recall patient after 5 to 7 days. Now what happens, why I'm talking about lesser number of patient recall, let me show you one case. Like in this case, if you see, with the help of laser, we can expose the canine, same sitting, and as there is no bleeding, I can always place the bracket, same sitting. Let me show you some my cases. Like this cases, I just showed you this case. Again, canine, if you see here, we were able to expose, and it was ready for bracket placement in the same sitting. So another cases, if you see, this was like palatal place canine. Difficult case, what we did here, we exposed, and then again we placed the bracket, same sitting. Another case, impacted canine of lower molar, mandibular. Tricky case, we went on digging, and here I had to do under anesthesia because it was quite deep. So you can see here, particular, we used an insulin needle to give anesthesia, but we were able to expose in same sitting, and we were also able to place the bracket in the same sitting. You can see here. So what happened here? The patient, conventional appointment, think about it. In conventional appointment, I would have taken 15-20 minutes to convince patient for the treatment. Again, give anesthesia, wait for the anesthesia, again do the surgery, perform surgery, then control the bleeding, pack, give a pack, whatever pack, a periodontal pack and all required, and then send the patient back and recall. So this process would have taken 30 to 45 minutes. Recall the patient after 5 to 7 days, remove the pack if we have given any pack, remove the pack, and then again place the bracket. Another 15 to 20 minutes or up to 30 minutes. But here, with the help of laser, what is happening, I can expose, I have to just apply topical, or maybe even if I'm given anesthesia, it takes just 5 to 10 minutes, and placing the bracket again when patient is already on the chair, it takes just 5 more minutes to place the bracket. So I'm finishing the patient in less than 20 minutes, and I have more time for other patient, as well as the appointment which this patient would have come after 5 to 7 days, I can schedule for some other patient. So increase in productivity, that's what I meant when I'm introducing laser in the practice. How about increasing more productivity? Like I just mentioned, the procedure which we have read, but we have never performed in the practice, right? So increase more productivity by scheduling treatment assisted by dental laser. So these are the some uh, topic which we have just covered. We can talk more, but right now let me go through the other slides. So taking something, no, this is something, these following few slides are very important, not only from the laser point of view, but even in the general practice. And why I'm focusing again and again, see, two important, very important factors which motivate patients are the how you communicate with the patient and how you're doing consultancy. So perio is very important for laser dentistry, and in order for patient to understand the value of perio, we must able to explain to them the advantages of laser dentistry and normal perio treatment. By knowing some data, let me discuss you some data, so it will be easier for us to communicate also. And this is for the people who have already bought the lasers, for them also, and also this is for the people who are motivated to buy laser. What is happening now? Think about it. Clinical studies have shown that diabetes are at a high risk for periodontal disease, and uncontrolled periodontal disease make it more difficult to maintain adequate glycemic control. So why I have mentioned it here, whenever we take a proper case history, it is important for us to ask the patient whether they are diabetic or not. So if patients are diabetic, take them, note down their number, their files or details and all other thing, right? Then those patients, whenever they are coming to you, explain them this slide. Patients with uncontrolled periodontal disease are at the higher risk for stroke and heart attack. There is a link between diabetes, stroke, heart disease, and periodontal diseases. So we have to explain the patients that you need to take more care of your gums than the normal people, and this can be possible only if you coming to or visiting to a dentist. See, they have to follow the proper oral hygiene, plus they have to visit dentist periodically, right? So we have a data now. Why I talk about these topics? We have a data that of all of our patients, and we know who all patients are diabetic. We can always schedule their appointment in our free time. We have to call them and say they let them come. We can check their periodontal status, and then if there are periodontal issue, we can use lasers. I have just, my slides were a little bit ahead, earlier slides, so we can always explain them. See, you have to go through these treatment done, and this is the laser treatment, and if we do it regularly, your gums will be happy, and you will be at the lesser risk of heart disease, cardiac diseases, and also you will be better position to maintain your diabetes also, right? So this is the one way of increasing more patients, or your we just discussed about increasing more patients, and also about integrating about the laser dentistry specifically. Same way. Okay, these are the some data which again are taken from the various journal. Women with periodontal disease are 4 to 8 times more times likely to have a premature lower weight babies. Also, pregnant ladies, they can come to dentist because it is very common to have gingival issues in the pregnant ladies, and we have to explain laser can help them, as many treatments are not possible, but laser is absolutely safe. It is again a non-ionization type of radiation, so it is absolutely safe for them to use. So they are again one category. If the women who are pregnant, they can always come for gingival treatment during the pregnancy, and they can get it done. So studies, again recent studies show that bacteria from the mouth and the pregnant mother's uterus are the same, hence oral bacteria crosses the placenta, right? University of Buffalo has also done a study where they first studied to establish unequally a link between dental hygiene and respiratory infection. So respiratory, the patient with which have asthma and all, they are also a probable patient for us to go through for a laser treatment. So these are the some data, and let me pass through a little bit fast because I have to still cover many more slides. So these are again some articles which we have collected data, and all of you are welcome. If you want any of these journals and articles, I can share with them. And we will have a question answer session today after the webinar. So any doubt, feel free to ask me the questions also. So again, the consumer patient needs to know three things. This is also something like I've told, communication is very important. So the first, oral disease is a disease like any other, and it's and in of itself of deserving the treatment. Number two, everything in the body is connected. Having a chronic infection is a serious problem and that you should not ignore. It can indeed make your systemically cyst. So if they are suffering from any chronic gingivitis or chronic periodontitis and all, they can always get more problem. So they have to get it treated. Last thing, what patient should know. Patient should not think that the treating periodontal disease will guarantee them lifetime. Acha, this is important from the dentist point perspective. We have to explain that patient, if they are getting the periodontal treatment, that doesn't mean they don't have to take care of their heart and other. This is the one step where they can control, or they can live a healthier life. So getting a treatment done will give them advantages, but that doesn't mean just getting a periodontal treatment will treat their diabetes or will treat their cardiac disease also. So you have to explain that also, right? So now if you're giving to this is like what why I showed this. Now when we are going to perform LAP, what is LAP here? LAP is laser assisted periodontal treatment. Now I told laser can be substitute for your retraction cord, can be substitute for cautery, but not for ultrasonic. So you have to use ultrasonic. So after we remove the tartar and bacteria from the root surface, we will use our laser to remove the diseased and infected tissues from under the gums. Once the gum pockets are clean, we will let the body go through a natural healing process and recheck those pockets in 4 to 12 months. This process has been very successful in thousands of patients worldwide. So this is how we explain the laser treatment to the patient. So communication is important, your soft skills are important, and your consultancy is important. But uh, they always help, and we have sufficient, like I can talk about my practice in the last, like I'm practicing since almost 19-20 years, so we have decent data of all the diabetes patient. We regularly call them for regular checkup and all, and if there are periodontal issue, we perform lab, right? So by looking out for perio patient, that can help you get a good revenue to the bottom line of your practice. This is again something which have been asked many times: separate laser fees. This is depending upon patient to patient, person to person, dentist to dentist. If I'm doing a normal treatment, let's say if I'm doing a freenectomy, if I'm doing with the scalpel and I'm doing with the laser, do I have to charge separately? I personally, I don't charge anything extra for that, because there I'm doing the same treatment. So there is no surcharge if I'm doing a conventional surgery. But if I'm talking about laser periodontal treatment, all this is a specialty treatment and which you are performing. So you can always schedule per tooth, quadrant wise duration of the procedure performed. If one common example again I'll give you here. If you're doing a full mouth periodontal case and you tell patient this treatment is gonna cost you X amount, they may not accept your treatment plan. So what we do here, you go quadrant wise, start with the one quadrant and start with the visit wise. So you tell, I mean, like we will be treating first quadrant in first visit, and treatment will be X by 4. So patients, whenever this option comes, they are more willing to accept a treatment plan. So you can always schedule that per tooth, quadrant wise, or also how much time you are going to spend on the patient. That is also a very important uh, aspect, right? Again, so it is only a win-win situation for a dentist to get ahead with the fascinating world of laser dentistry if they have introduced the lasers in their practice. This is again data. This data I have taken today only, and all of you, I mean, you can go to the Google and do this, the dental implant and peri-implantitis. So before that, let us talk about the market of implant. The global dental implant market is projected to reach USD 13.01 billion dollars. So by year 2023, that is next year only, by year 2023, the global implant market is going to reach 13.1 billion. And it was 9.50 billion in 2018. So in 5 years, it will grow 5 billion rate at the rate of 6.5% per annum. So implant is having a very huge market, we all know. Now, what is the role of laser and what is the role of peri-implantitis here? So again, this data I just googled today morning only. What how common is peri-implantitis? So it is assumed, or it is a common that almost 28% of patients with dental implant develop this inflammation. Now, 28% of patients with implant can have peri-implantitis. But that doesn't mean failure of implant. Touch wood, or by God grace, is implants is a very successful treatment. Only less than 2% failure rate, means 98% success rates are there. But that doesn't mean they cannot have peri-implantitis. Peri-implantitis is common. It is just 28. It can be 28% of the patient with dental implant. Of course, because maybe poor prosthesis or cement or many factors are there. So, like I just discussed in my earlier webinar also, for treatment of peri-implantitis, very few treatment protocols are there. Either you use pad, or you use uh, Teflon tips, or you use microbrush, or you use laser. So you have another set of patient. The patient who have got your treatment done through you, the dental implants, you can always keep an account on them, schedule their visit once in a year just to get a routine checkup done. And if required, you can do laser dentistry there also. for treatment of periimplantitis, even if it is the juvenile stage or early stage only. So this is another aspect where you can get more cases of the implants, patients' implants, and increase your revenue in your practice. Right now, the question comes: before buying anything, it is well to ask if one can do without it. So many time I've been asked question, doctor, you talk about surgery. I am doing with the scalpel. Scalpel costs few rupees. Your laser is going to cost 3 lakh rupees. Doctor, I have electrocautery. Electrocautery is just few thousand rupees. Your laser is costing this much of money. So why should I buy this? So let me go through review of one by one aspects, and then we'll come to we will compare all three method of surgery. So some question to ask yourself before buying: what can I do better with the laser that I have already have? So for me, laser was like a wonder tool. So I have done many things which I was not doing earlier. Right, what laser wavelength is appropriate for the procedure? So we are talking specifically here for the diode, and I'll tell for the surgical procedure. For the surgical procedure, nothing beats 450 nanometer, and for disinfection and periodontal problem, nothing beats 980. So these are the two wavelengths which I prefer and I'm using currently in my clinic. What lasers have that indication of use? Which companies have good training and support? Indication of use. So whenever we talk about indication for use, always go for operator manual, FDA clearance, other regulatory bodies instructions and mandates. Certain devices have certain clearances. Right. So short checklist also very important before buying the device. If you're going to buy a laser, what are the features? What are the control? How to set up? They should be user friendly. How to sterilize the tips? So always removable tips are better. Ergonomics, how easy they are to be used. Portability, whether you can carry them to one chair to, if you have a multiple chair, whether you can carry them to one chair to other chair. What are the supplies and how easy they are available? This is also important because you buy a laser. Like few years I had a laser which I bought few years back. I will not name here because it is not unethical to name that company. But that somehow that person who was dealing with the laser, he left that company, and I faced lot of problem in getting fiber rolls. So those are like fibers. So this is again very important. And what all the accessories you are getting with the devices also. Short checklist of company, like which company you are buying, how long they are into the business, whether they will provide training, what is the support, whether they are giving the warranty, what about troubleshooting, customer satisfaction and track record. So these are the certain things you need to check about the company also. Like today I can since we are we got this platform and we are together with the woodpecker through woodpecker, so I can tell woodpecker is more than 30-year-old company. They are in India since almost 15 years, and their dealer in India ideas, they have got amazing record. I know in Lucknow, whether I have a small problem, not only the problem got cured, even for the time being when my laser, see laser, I never had a problem. Even for the other equipment, I can tell you the endomotor with the what I was using, there was some battery issue, and the company gave me a replacement for the time it was repaired. So they have a beautiful background and service network in India, and after sales satisfaction. So let's talk about advantages and comparison also. So like I just mentioned, there are three method which are used for surgery: scalpel, laser, and electrocautery. So all three works. However, they are different from the standpoints of hemostasis, healing, cost of instrument, width of the cut, anesthetic required, disagreeable characteristics such as smoke production, and the odor of burning flesh and undesirable test. Let's talk about electrocautery. Electrocautery, see, it is not absorption specific, and moreover, so it doesn't know whether it is. What I mean by absorption specific, when I'm using a laser, I know the chromophore, so laser will only get attracted by those chromophore. Whereas electrocautery, it doesn't know what is the chromophore. It will cut whatever will come in front of him. So what happened? There are a lot of collateral damage. Sometimes 500 micron, 800 micron, or sometimes even up to 1700 micron, which is a lot of collateral damage. What about soft tissue with the scalpel? See, it is something which is irreplaceable, but there are certain points which we cannot compare with the laser when we are comparing with soft tissue with the scalpel. See, with the scalpel there will be bleeding, we have to place anesthesia, right, and it will cause pain. So you cannot compare this, but then there are certain advantages also. Cost effective, it is very cost effective. So laser, I will not say it will replace a scalpel, but it will minimize or it will reduce the use of scalpel in your clinic. What about laser? Enough studies are there, and I'm already last 3 webinar we have discussed about it. It's amazing tool and all. So let's see this chart. I mean, this chart will sum up the advantages in a scalpel. This chart again, I have taken it from British Medical Journal (BMJ) and not by made by me only. So anesthesia is required in scalpel. Anesthesia is also required in electrocautery, but in laser, 90%, 80-90% cases, it is not required at all. Bleeding will be there in a scalpel. Bleeding will be there. Will not be there in electrocautery and lasers. Suturing is required in a scalpel. It is also required in electrocautery, but in laser, depending upon situation, most of the time it is not required. Healing time, scalpel is less because we all know blood is there, and healing is primary by the primary intention only happens when blood is there. Electrocautery, it is moderate. It can take up to 15 minutes because of collateral damage. Understand this. Whereas with the laser, 5 to 7 days. Patient comfort, amazing. So laser always is better compared to other two modalities. And we have already discussed different treatment which you can do. And again, laser is not only a surgical tool. Laser is not only used for cutting. It can be used against metal. I just told, if crown is present, I can use laser. If implant is present, I can use laser. Has zone of necrosis only 3 to 5 cells deep, so less invasive. It has got perio application. I can use laser for bleaching. I can use laser for desensitizing of teeth. I can use for herpes and abscess treatment. Also, it has got marketing benefit. So these are the certain advantages. I mean, people call themselves laser dentists, but I have never seen anyone calling them cautery specialist or cautery dentist. So certain advantages are always there when you're using laser. I have a figure where I can compare laser cut versus electrocautery. I'm a bit. You can see here, laser cut is precise, whereas collateral damage is very less compared to electrocautery. Wide and collateral damage is very high. So zone of coagulation is very high in cautery, just to compare the cut between a laser and electrocautery. Scalpel is of course fine, and it is more precise. So scalpel I have not compared, no doubt. Scalpel is more precise when compared to laser and electrocautery. So I have not compared it here, right? So this is zone of inflammation, same. So advantages, again, I'll go through. Their use requires minimal or no anesthetic. They do not harm dental heart tissues. Their judicious use does not injure the dental pulp because of low or no heat production. They can be used around the dental implants. They have antimicrobial property. They remove endotoxins from the root surface. There is growing evidence that laser use may be positive therapy for periodontal disease. Laser technology is considered state of the art by the lay public, so patients are more accepting of its use in their treatment of electrocautery compared to electrocautery, right? So these are the certain advantages. So this sums up my today's webinar. So what is the conclusion? Today's conclusion: lasers are the key to the future dentist. There was article few years back. Laser is future of dentistry. It is already accepted. Laser and implants. So the articles earlier, what I read in early 2000, let's say 2008 and 9, they used to comment like laser and implants are the future of dentistry. Implants are already there. So laser is something like this is due to the future. Understand this. Still less than 1% dentists in India have access to laser dentistry. So be among the first to introduce into the clinic high technology and state of the art equipment. No doubt about it. Will definitely unlock doors to the dentist to perform a wide variety of dental procedures. I have just sum up few of those procedures. Remember the story of Nokia. Nokia story, if you go, it is a very famous story, and most of us know that Nokia was one of the most, not one of the most, it was the most popular mobile phone at its time. But what happened? They failed to adopt the newer technology. They thought that they are doing ethically, and there is a very famous speech by CEO of Nokia where they say, we never know where we went wrong. So where we went wrong, we were ethically, we have never done anything wrong. We were doing best of the we were giving best of the equipment, best of the material. But what caused failure to them was the adopting themselves to the newer technology. What happened with the Android and iPhone Apple platform? They were adopting the newer technology. Now, why I'm talking about Nokia here? Like many times I just mentioned also, I'm doing treatment, very good treatment. Why should I adopt? See, silver amalgam, you can do a proper cavity, no doubt about it. But then remember, they are obsolete, outdated. Obviously, currently, the current technology says it's minimal invasive dentistry. So you need to adopt that. You can do a very good root canal treatment by using hand file step back technique. But remember again, it takes many settings. It takes a lot of time. For patient point of view, doing a single sitting or maybe two visit root canal treatment is always better, because patient it will I mean patient times is also important, as well as your time is also important. So something about this, like why you should adopt these treatment or laser dentistry. So again, for all of you, thinking like a laser dentist is the first step for successful laser treatments. If opportunity doesn't knock, build a door. That is the saying by Milton Berle. So again, I started my webinar today with a video of Van Dam. Uh, I want to end up, since it is the last webinar, I want to end up on a comical note or a funny note. I don't know how many of you have heard of Chuck Norris, but he's like a very famous Hollywood actor. And the ad I show by Van Damme of the Volvo, he came up with his own idea. Let me show you that ad with the video. After that, we'll go for question and answer session.
Some says that ever gaze that season comes, when our Savior's birth is celebrated. The bird of dawning singeth all night long. And then they say, no spirit can walk around. The nights are wholesome, and no planets strike, no fairy tales, no witch had power to charm. So hello, and so gracious is the time. So I brought you there. Very Merry Christmas, and Happy New Year to you all.
So, if Van Damme was precise, that was for near infrared wavelength lasers. Now, 450, we have got a 450 nanometer wavelength blue laser, which is more precise, like Chuck Norris here, and can work wonders. So, this is me, my contact email ID, and my WhatsApp number. I am free for questions. If we have any questions, I will be more than happy to answer. So, do we have any question? Thank you very much. I don't think we have any questions. Lucy, can we sign off?